Hi, good afternoon. This is Dr. Hundrada. I'm here with Dr. Alex Mangarian. This is our whiteboard series of bipolar disorder. Last time we talked about neurobiology of impulsive behaviors, grandiosity, and lack of insight that we see in patients with bipolar disorder. Today we are going to talk about the findings in patients with mania, especially the areas of the brain that shows hyperactivation or hypoactivations in mania. Before that, let's look at some of the areas of the brain that we are going to talk about. So we have MRI series here. We have an axial scan where I want you guys to actually focus on the medial part of the temporal lobe. So this is the medial part of the temporal lobe here. This is the medial part of the temporal lobe, and this is your midbrain right here. The medial part of the temporal lobe, you have uncus here, right? And the medial part of the temporal lobe, if you look at the sagittal section, this green area is the amygdala, and the pink area is the hippocampus. So they are usually present on the anterior-medial part of the temporal lobe. And the important function of the anterior temporal lobe is that it is a hub for semantic memory. We are not going to talk about semantic memory this time. And the anterior temporal lobe also plays a very important role in integrating your visual, auditory, as well as your limbic information, right? And it usually converts a unimodal perception into a multimodal concept. And we'll talk about it sometime in future, what this exactly means, all right? This basically means that the visual, anything that you see or anything that you hear or any emotions will access your anterior temporal lobe or the semantic memory and is usually going to convert a particular perception and gives it a meaning. We'll talk about it in our future lectures, but I just want you guys to know that the anterior temporal lobe, the medial part, consists of the amygdala as well as the hippocampus. And the amygdala, the green one, usually sits on the anterior part of the hippocampus. Here we have the coronal view. So the green one is your amygdala, and the pink one is the hippocampus. All right. So why am I talking about amygdala? So if you look at amygdala, we know what the function of the amygdala is. So amygdala is usually responsible for encoding aversive stimuli as well as threat information, right? So it usually gives a salience and a valence to a particular stimuli, right? Valence means that is it important, is it good or bad? And salience means it's important or is it not important. So what they have found is that in patients who are in a manic episode, there is an increase in the activation of the amygdala is seen, right? And the left amygdala is more active than the right amygdala. So this basically means that there is a bilateral activation of the amygdala, but left is more than the right, all right? Now, what does this signify? An increase in the activation of the amygdala basically means that this particular patient who is in a manic episode will have increase in their emotional sensitivity, and they will have an exaggerated physiological as well as a behavioral response to an emotionally salient stimuli, right? And this in turn can lead to emotional dysregulation and mood instability that we do see in patients with bipolar disorder, especially when they are in a manic episode. Another thing I want you guys to remember is that amygdala is also actually a part of the salience network, right? And what's the function of a salience network? The salience network will give salience to a particular stimuli, right? So it will basically increase the intensity and the saliency of a physiological response to a particular stimuli, all right? So in short, in patients who are in a manic episode, you see an increased activation of the amygdala. The left amygdala is more active than the right amygdala, which in turn leads to increase in the emotional reactivity or sensitivity and an exaggerated physiological and behavioral response to an emotionally salient stimuli. So we know that in manic episode, there is an increased activation of the left amygdala more than the right. So there is an imbalance. In manic patients, they also found that there is an increase in the activation of anterior cingulate cortex. We already know where exactly the anterior cingulate cortex is located, but this is a good revision. So when you look at the sagittal section of the brain, first locate the corpus callosum, right? That's a white matter tract that connects the two half of the brain with each other, right? Just above the corpus callosum, you have the cingulate cortex. That is in green. The anterior 1/3 of the cingulate cortex is the anterior cingulate cortex. The middle 1/3 is your middle cingulate cortex. And the posterior 1/3 is your posterior cingulate cortex. Right? So we will be basically focusing on the anterior cingulate cortex. Right? So in patients with mania, there is an increased activation is seen in the anterior cingulate cortex. The left is more active than the right. Right? So both are activated, but there's an imbalance. Now, what's the significance of an increase in the activation of the anterior cingulate cortex? As we all know, anterior cingulate cortex is also, especially the dorsal anterior cingulate cortex, is a part of your salience network. And the function of the salience network is to increase the intensity and salience of a physiological response to a particular stimuli, right? So you're going to assign salience to a stimuli. Any abnormality in the salience network can lead to abnormal salience mapping, or you're basically going to assign a salience to a signal that is not considered, that is not actually salient, right? So in patients with manic episode, we know that there's an increased activation of the anterior cingulate cortex, right? So there will definitely be an abnormal salience mapping, right? What's the function of the anterior cingulate cortex? So what the anterior cingulate cortex actually does is that it's an interface between the decision-making frontal lobe, right? We all know where the frontal lobe is here. This is the frontal lobe, right? And the emotional limbic system, right? So it is usually acts as an interface between the decision-making frontal lobe as well as the emotional limbic system. So what the anterior cingulate cortex usually does is that it's responsible for selecting as well as learning a behavioral plan, and it usually contains the motivation behind a particular action, right? So whenever the anterior cingulate cortex is damaged, there will be a problem, especially with the motivational behavior, right? It can lead to apathy if there is a stroke in the anterior cingulate cortex. So another function of the anterior cingulate cortex is that we know it actually from our depression talk. Anterior cingulate cortex is also responsible for the top-down control over your amygdala, right? So it's responsible for the top-down control of your emotions, right? It's responsible for modulation of the emotion so that your emotions are contextually appropriate and socially acceptable, right? You are not freaking out, right? So in psychiatry, any kind of behavior that causes a functional impairment, we consider it to be abnormal, right? So the anterior cingulate cortex is responsible for the top-down control of emotions, especially it's effect on modulating the functioning of the amygdala. The question will be, if there is an increased activation of the anterior cingulate cortex, why is there an increased activation of the amygdala? Because if you look at it, an increased activation of the anterior cingulate cortex should inhibit the amygdala, right? So here we are not talking about the problem with structural connection, right? There is a problem, especially in the functional connection. And the functional connection could usually be because of a change in the number of spines, dendritic spines I'm talking about, or especially neurochemical, right? Because of this problem in the dendritic spines and the neurochemistry, there's a functional disconnect between the anterior cingulate cortex and the amygdala. So there is no structural problem, but there is a functional problem. And that is the reason we usually do not have the top-down control of emotions. And we know that in patients with mania, this leads to emotional dysregulation as well as mood instability. What are other things actually that we see in patients with mania, right? So far we know that patients who are manic, there's an increased activation is seen in the amygdala, the left more than the right. There's an increased activation is seen in your anterior cingulate cortex, the left more than the right. Other things that are seen in patients in mania is there's a decrease in the activation of your ventrolateral prefrontal cortex, especially the inferior frontal gyrus, right? Just remember one thing, that the ventrolateral and the dorsolateral prefrontal cortex also plays a very important role in the top-down control of emotions, all right? So top-down control of emotion basically means that these areas of the brain are responsible for modulating the function of the limbic system and thus modulating our emotions. Here, the right ventrolateral prefrontal cortex is involved more than the left, right? So there is a decreased activation of the ventrolateral prefrontal cortex in patients in a manic episode. Now, this decreased activation of the ventrolateral prefrontal cortex is not just seen in manic episode, but this is also seen in patients who are euthymic. So now, the conclusion is that the decreased activation of the ventrolateral prefrontal cortex could be a trait marker for bipolar disorder. Okay, so this is consistently replicated, this particular finding. In manic episode, there is also a decreased activation seen in the ventromedial prefrontal cortex, which is the medial part of your prefrontal cortex, right? So if you look at this, the ventrolateral is here, okay? The ventromedial is the medial part of your frontal lobe, all right? So the patients with mania also show a decreased activation of your ventromedial prefrontal cortex, which is basically the medial PFC, all right? Now, other findings that we see in patients with mania is that there is also an increased activation is seen in the basal ganglia, especially the caudate as well as the globus pallidus, as well as the thalamus, right? So in patients with mania, there is an increase in the functional connection seen between the basal ganglia and the thalamus. And this connection is modulated by two neurotransmitters, dopamine as well as serotonin. We will talk about this in detail sometime later. So what dopamine does is that it increases this functional connection between the basal ganglia and the thalamus. In the next lecture, we're going to talk about the neurobiology of or neuroscience behind psychomotor agitation and retardation. But the significance of this increased activation of the basal ganglia and thalamus in mania is that the increased functional connection can lead to psychomotor agitation. And psychomotor agitation is one of the clinical symptoms in patients with bipolar disorder, and this can also usually lead to increase in the goal-directed behavior. The last thing that is seen in patients with bipolar disorder, especially manic episode, is an increase in the activation of the insula, especially the right more than the left. Now, what's a function of insula? As we all know, insula is also a part of your salience network, right? So now we have actually seen three different areas that's a part of your salience network: the insula, the amygdala, and the dorsal anterior cingulate cortex, right? So insula is responsible for something called as interoceptive awareness, the awareness of the physiological response of your body, right? Like, for example, your heart rate, your breathing, right? Your GI function. These are all actually the interoceptive signals. So it's responsible for interoceptive awareness. Plus, it's a part of the salience network. So if the insula is not working well, it can also lead to problems with salience mapping, right? Assigning abnormal salience to emotional stimuli, right? So if you actually assign an salience to a neutral emotional stimuli, you can actually increase the saliency as well as the intensity of the emotional stimuli, again leading to emotional dysregulation that we see in patients with bipolar disorder. Another thing that we see with insula is that the anterior insular cortex, if you look at the neurobiology for patients with narcissistic personality disorder, there is a problem, especially in the anterior insular cortex in patients with narcissistic personality disorder, because the anterior insular cortex is also responsible for empathy. So when there's a dysfunction in the anterior cingulate cortex, people can actually lose empathy. And that you can see in patients with manic episodes, right? They do impulsive things, they have no insight into it, and it appears as if like the person is antisocial. So let's summarize everything that we talked about, right? So let's make two tables. So one is mania, and then we have euthymia, right? So areas of the brain that basically shows decreased activation, that we know it's ventrolateral prefrontal cortex, that is the inferior frontal gyrus, as well as the ventromedial prefrontal cortex, that's your medial PFC. We'll talk about the function of the medial PFC sometime later. Here, the right side is affected more than the left side. Patients with euthymia, we see decreased activation of the ventrolateral prefrontal cortex, right? Right more than the left, and thus the ventrolateral prefrontal cortex hypoactivation could be a trait marker for bipolar disorder. Areas of the brain that actually shows increased activation in mania, we have the amygdala, that can lead to increase in the emotional hypersensitivity as well as exaggerated physiological response to a particular emotion. This increased activation is also seen in the anterior cingulate cortex, which leads to loss of the top-down control of your emotions. So you lose that inhibition of the amygdala. So there is a decrease in the functional connection between the anterior cingulate cortex as well as the amygdala. Here, the left side is affected more than the right side. There's an increase in the functional connection seen between the basal ganglia and the thalamus, which we know is responsible for psychomotor agitation, as well as increase in the goal-directed behavior. As well as there's an increased activation is also seen in the insular cortex, the right more than the left, and the insular cortex is responsible for interoceptive awareness. It's also a part of the salience network, leading to abnormal assignment of salience, and thus we are actually increasing the intensity of salience of an emotional stimuli, and this can lead to emotional dysregulation. I hope this makes sense. Thank you.